fetal monitor skill on our patient. First thing I'm gonna do is knock on the door, enter the room, identify myself, identify my patient, ask name and date of birth, raise the bed, perform hand hygiene, put on some gloves. We're going to place the toco transducer. The toco transducer is monitors contractions. We're going to find the apex of the uterus, make sure we place the middle of the toco transducer there, right to the skin. We're going to secure the toco transducer. Next thing we're going to do is we're going to place the ultrasound. We want to do the Lewis maneuver to find the fetal spine, and we want to find the point of maximum intensity of the fetal heartbeat. We're going to place the ultrasound there. We're going to make sure the heart rate is 110 to 160. That would indicate a normal heartbeat for a fetus. Cover the patient back up. We're going to check the fetal strip to make sure the heart rate and heart looks like it's doing what it's supposed to be doing. Then we're going to lower the bed. We're going to place the call light, tell the patient I'll be back to check on her shortly, ask her if she needs anything, remove my gloves, hand hygiene, and go document. Next is the postpartum assessment. I'm gonna just get my patient ready. Postpartum assessment would be after the patient has already delivered the baby. We're gonna knock on the door, introduce ourselves, identify our patient, ask name and date of birth. We're gonna ask the patient if she's urinated recently. She says she has. We're gonna raise the bed. We're gonna perform hand hygiene and apply gloves. Okay, first thing we're going to look at in the assessment is we're going to check her breast. We're going to look, she has a bra on. We'll make sure that she has a bra on. We're looking for engorgement, redness. If she's breastfeeding, we're looking for cracks, bleeding. If she's not breastfeeding, we're going to make sure to educate on how not to stimulate milk production. Next thing that we're going to do is we're going to listen for bowel sounds. Bowel sounds are present in all 4 quadrants. Next, we're going to palpate the uterus. We're going to stabilize the uterus, and then we're going to look for the top of the fundus. It's usually at the midline, 1 inch above or 1 inch below the umbilicus. We're going to check to make sure the fundus is nice and firm and not boggy. If it's boggy, we would want to do fundal massage because that could indicate, be a sign for hemorrhaging. Okay, after we've done that, we're going to ask about her bowel, make sure she's had a bowel movement. She indicates she has. We're going to ask about urinating. She says she's urinating okay and it looks normal. Next thing that we're going to do is we're going to check her lochia. We're going to ask the patient to turn to her side. Once you have the patient on her side, we're going to check the lochia. We're going to look for a scant to moderate amount if she's just delivered. If there's a heavy amount, which is filling a pad within 1 hour, we're going to notify the provider immediately. If we need to provide pericare, we're going to remove the pad front to back, place a new one front to back. We're going to check the episiotomy. We're also going to check for hemorrhoids at this time. If she delivered by C-section, we're going to check the incision, looking for redness, swelling, or any type of infection. All that looks good. Next, we're going to do hand hygiene, remove our gloves, get a new pair of gloves. The next thing that we're looking for is we're looking for edema. We're going to check her extremities for edema. We don't want the patient to get any DVTs. A DVT could be indicative if there is swelling on one side and not the other. Her feet, legs, nothing looks swollen. Ankles, we're going to check her hands and her wrists, arms. Doesn't look like there's any edema there. Her face, she doesn't have any edema on her face. All that looks good. Next thing that we're going to ask about is we're going to ask about how she's bonding with her baby and if she has any questions about that. She doesn't. And then the last thing that we're going to ask is about pain. We're going to see if she has any pain. She says she doesn't. I tell her that if she does, to make sure she uses the call light and call me and let me know. I'm going to give her the call light, lower the bed, tell her if she needs anything to call me. I'm going to take off my gloves, perform hand hygiene, and go document.